So a dental implant in its crudest form is just a screw, a metal screw, titanium, that goes into the jawbone. And into this we fix a implant crown, which is much like a normal crown. It's just screwed into the implant as opposed to a crown which would go onto your actual tooth. So most people would actually say the implant procedure itself is actually even less painful than having an extraction done. So really it's not painful at all, and especially the way we practice these days is minimally invasive, meaning less painful surgeries. The implants will generally last, and most of the literature would possibly say 15 to 20 years for the actual screw part of the implant. The crown, like any other part, any other crown or restoration filling in the mouth, has a finite lifetime because it's the part you use and you eat with and talk with, so it has more wear. So let's say if we say 15 to 20 years for an implant, I would say approximately anywhere between 8 to 10 years for the implant crown. So why might you need an implant? Well, the most common reason would be that you're already missing a tooth, but also if you have broken teeth, teeth that are wobbly, or teeth that you've been told are fractured or cracked and need to come out, then an implant is a great way to replace these. So the implant itself, once it's placed, it's done in phases. So we have a surgical phase, which is actually placement of the screw. And after this, you're really largely the same as you were before we've done anything anyway. When we actually place the implant crown on, which on average can be anywhere between, let's say, anywhere between 4 to 5 months, then as soon as that implant crown goes in, it's as good as a normal tooth and it's ready to go. So the only things, without getting to specifics of the actual post-op instructions following surgery, there are specific dietary requirements or maybe exercise. We would ask you to reduce certain things, but other than that, realistically, there's not a whole lot of limitations. So now we actually are practicing more, so let's say less invasive surgeries. We're practicing more, perioplastic, we would call it. So that means more like, I suppose, aesthetic surgery as well in a way. And because of this, the sutures and the way we do our surgery is more likely to lead to quicker healing. So realistically, after 1 or 2 days only, I would usually say the gums are back to normal and within a week completely healed. With regards to downtime after the procedure, we would usually recommend you rest up for at least a day after, possibly not working, definitely no heavy lifting if that's what your work involves. From the next day, you're pretty much back to normal. Yeah, so the implants are great because as soon as that crown is screwed in, actually this implant is ready to go and to be used, so you feel free to chomp away. Yeah, so with regards to maintenance of an implant, it's much like a tooth. We would recommend you're going to brush it similar to a tooth. You're going to use floss like you would around a tooth. Some people even advocate the use of TP brushes, and you can get specific TP brushes for implants. But we also want you to attend regular or routine review appointments so that we can make sure that we're taking x-rays, we're just checking areas that may be harder for you to get to, so we can try and prolong the lifeline of this implant.